welcome. Thank you so much for joining us. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Climate Change and Health series, a special collaboration between the Blum Center, the Mass General Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before I get started, just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so we can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I'm going to introduce you all to our guest speakers. Joining us today, we have Dr. Suellen Breakey. Dr. Breakey is Distinguished Teaching Associate Professor in the School of Nursing. She is also the Associate Director of the Center for Climate Change, Climate Justice, and Health at the MGH Institute of Health Professions in Charlestown. Her clinical background includes global health and critical care nursing. Dr. Breakey teaches in the Doctor of Nursing Practice and Accelerated BSN programs with a focus on ethics, evidence-based practice, and population health. Joining us today, we also have Dr. Patrice Nicholas. Dr. Nicholas is Distinguished Teaching Professor and Director of the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. She is also the co-director for policy and advocacy of the MGH Center for the Environment and Health. She teaches in the Doctor of Nursing Practice program and advises accelerated Bachelor of Science and Nursing students at the MGH Institute. She also serves at the MGH Center for the Environment and Health on behalf of the Department of Nursing and Patient Care Services. They join us today to give a talk on extreme health and air pollution. Before I turn it over to Dr. Breakey, Dr. Nicholas, do you have a few words you'd like to share with the audience?
Thank you, Amy. Welcome to everyone, and we're delighted that the Climate and Health series has garnered so much interest within the MGH family, patients and families, staff, and leadership. So thank you for joining us. And Dr. Debbie Burke actually called out climate change and health in her Nurses Week presentation that was on the MGH Minute this past week. So thank you, Amy. Thank you, Suellen.
Okay, so why don't we get started? I'm just going to share my screen. Hang on one second. Okay, so thank you, Patrice, and thank you, Amy. It's been a pleasure to be partnering with you in this Climate Change and Health series, and so we really appreciate your allowing us to do that. Today we're going to talk about air pollution and heat, both as individual impacts of climate change and then also how their intersecting effects on health as well. Let me hold on one second. Okay, and so we're going to look at the impact of heat and air pollution on health. We're going to identify contributors to poor air quality and define safe air quality limits and or satisfactory air quality limits as defined by the government. And we're going to identify strategies to mitigate the impact of heat and air pollution on health. So essentially things that you can do to decrease your risk from these two climate impacts. So the there was a study that was put out and highlighted in the 6th National Climate Assessment, and it was done by firststreet.org, which is a climate, a kind of a climate group that looks at research. And they found that the incidence of heat that exceeds the threshold of the National Weather Service highest category for heat, which is called extreme danger, and that's a heat index above 125 degrees Fahrenheit, is expected to impact 8 million people this year. And those numbers are going to jump to approximately 107 million people by the year 2053. And so what they refer to this as an extreme heat belt. And it's primarily concentrated in the middle of the country where there's no relief from oceans or other bodies of water. So this is probably familiar to people, but just to kind of look at what is a heat index, this is from the National Weather Service, and how do relative humidity and temperature, how are they related, and what does that mean in terms of the impacts of extreme heat? So, it's important to note that you can have relatively dry heat, but there can also be the impact of humidity on heat is that it makes your body feel as if it's hotter. And these numbers that are in this table were actually derived in the evening hours. So not even daylight hours when the heat is the strongest. So for instance, if you look at, pardon me, if you look at, let's take a 90-degree day, and there's a low relative humidity, you can see that, 90 feels pretty close to 90, but that those numbers go up as you increase humidity. So when you get to like 75% humidity, a 90-degree day feels like 109 degrees. And so the Weather Service and the CDC have classified, how we can look at relative humidity in terms of caution, extreme caution, danger, and extreme danger. And if you think about, and we'll go over the different heat-related illnesses, but within the caution category, this is the effect on the body. You're probably fatigued if you're outside too long, or if you're engaging in physical activity. Extreme caution can lead to heat stroke, heat cramps, heat exhaustion, with prolonged exposure of physical activity. Danger can lead to heat cramps or heat exhaustion, which is more likely, and heat stroke related to prolonged exposure and physical activity. And then extreme danger, where heat stroke is likely. And so if you think back to what that study found, then a huge number of people are going to be impacted and placed in extreme danger related to heat. And so this is heat-related illnesses are preventable, but with time and higher temperatures, that will be, it will be hard to prevent heat stroke and other heat-related illnesses. And heat stroke is oftentimes fatal and results in multiple organ damage and failure, which leads to death. So that's a pretty sobering statistic. For those of you who may not be familiar with the idea of urban heat island, what we know is that temperatures in urban areas are higher than they are in areas that have more green space, because trees and grass create, they act as carbon sinks, and then obviously tree canopy creates shade, which offers, which cools down the environment a little bit. Within cities, the urban areas that have more asphalt, that use air conditioning, that this is kind of a double-edged sword. You need air conditioning to stay cool, but it also contributes to the heat in the environment, in the outside environment. which leads to increasing temperatures in those areas. And the other thing about urban heat island impacts is that typically, when we live in a rural area or maybe a suburban area, during times of high heat, it cools down a little bit at night. But because the asphalt absorbs the heat, that heat is radiated into the atmosphere. So even at night, people don't get good relief from the heat. So there are several populations who are at risk for climate and environmental injustices, and both climate and environmental impacts are attributable to or account for air pollution and climate impacts. So the very young and the very old are at risk. Women and pregnant women are at risk for poor birth outcomes related to heat and poor air quality. Children, the socioeconomically disadvantaged, and oftentimes these are people who live in environmental justice communities, which are often urban heat islands, and have a lot of air pollution because of past environmental injustices. Indigenous peoples, communities of color, often live in environmental justice communities because of past racist policies like historic redlining, the effects of which are still seen today. People living with disabilities, people with housing insecurity, those living with chronic physical and mental illness. These are populations who are more susceptible to negative health consequences. This is a little bit busy, but this is for some reason, I couldn't get the title on this slide, but this is called the Heat-Related Illness Screening Tool, or the HIST, which Patrice and I developed with some of our colleagues. And this has been published just recently published, but we're continuing to work on the screening tool, but we think we created this tool that can be used by both individuals, it can be used by healthcare providers, it could be used to actually identify communities at risk. And it accounts not only for physical impacts related to heat and air pollution, but it accounts for environmental factors, social factors, and it identifies populations of concern. And so we think that this can be used as both a screening tool and an educational tool. I won't go through the whole thing, but if you look at environmental factors, you can see urban heat island is one factor. Lack of access to air conditioning or shade, outdoor workers, there's an occupational risk for outdoor workers, people who do construction, the military, firefighters, for example. Physical factors include several pre-existing conditions, both physical and mental or psychological, as well as medications that can impact, that are the way they work is impacted by heat, both from a physical standpoint and also from like a storage of some medications. You have to be careful about storing them in cool places, and so that can be impacted by heat. And then the people, in terms of social factors, those who are socially isolated are more at risk for heat-related illness. People who are dependent on the care of others, alcohol consumption, low-income earners, and non-U.S. citizens there are disparities both among non-U.S. citizens, and also there are racial and ethnic disparities in climate change impacts. And this is just to show you, this is local. I'm not sure if people are from outside Massachusetts who are on the call, but this is from a study that was done by the Mystic River Watershed Association and the Museum of Science. And they had approximately 70 or 80 civilian scientists who went out and actually looked at heat, they measured air quality they looked at tree cover, and this just kind of points out some of that. I think it provides a good picture of the environmental justice issues and the urban heat island impacts. And so you can see that when you look down at the bottom of the screen at Boston, Winthrop, Chelsea, um, Somerville, you can see those are the hottest areas. They're also pretty densely populated, and they are definitely urban heat island. Urban heat islands where they have a lot of asphalt and pavement. And then when you look up and into the kind of more suburban areas, you can see more that the temperatures are less. And so that's a pretty, that paints the picture pretty well. And then this is looking at tree cover, which is, again, important for cooling. And you can see the same areas when you move down closer to Boston, in and around Boston areas, you can see less tree cover. So again, higher heat and less tree cover. So you can see that those communities are more susceptible to heat-related illness. And so what extreme heat can do is it can exacerbate pulmonary disease. It can lead to increased cardiovascular disease. I mentioned worsening pregnant outcomes. So there are higher percentages of preterm birth, stillbirth, some congenital anomalies that are associated with heat and air pollution. Heat-related illnesses, which we'll talk about in a minute, increases in stroke as well, which all can lead to death. Okay, so just a few, and these slides are actually slides that we used in an earlier presentation last year when we were talking specifically about heat-related illnesses. But heat stroke is the most serious heat-related illness, and as I mentioned, there's a risk for death if someone who presents with heat stroke isn't treated quickly, then that can lead to multi-system organ failure. So high body temperatures, 103 degrees Fahrenheit or higher. The person would have hot, red, dry, or damp skin, a fast pulse, headache, dizziness, nausea, confusion, and they could lose consciousness. And so this is a medical emergency. If you were to encounter someone who was experiencing these symptoms, you'd want to call 911 right away, try to move the person to a cool place, help lower their temperature with cool cloths and a cool bath, and don't give them anything to eat or drink. So the key here is activate emergency services immediately. This is something you can't take care of on your own. Heat exhaustion, which is kind of one rung down from heat stroke. People who are experiencing this will have heavy sweating, they'll have cold, pale, or clammy skin, fast, weak pulse, they may be nauseous or vomit, muscle cramps, a feeling of tiredness, dizziness, headache, and they too may pass out. So you want to move them to a cool place. You want to put wet cloths on their body, give them sips of water. The key here is that they're not going to, their temperature won't be as high. And if the person is throwing up, or if this happens to you, or your symptoms get worse, or they last longer than an hour once you get to a cool place, then you want to seek medical help. And a lot of this, I would just want to mention, comes from the CDC website, which has some really good information these slides will be available, but you could also look to the CDC as well. Heat cramps. So this would be, heavy sweating during exercise, maybe some muscle pains or spasms. So you want to stop the physical activity, want to drink water or a sports drink, which might have some electrolytes, although you don't want to go too crazy on sports drinks in the hot weather because they can actually be dehydrating. and then you want to kind of rest until you feel better. But pay attention, because if if you need to get medical help, it would be if your cramps last longer, if you have heart problems or any pre-existing issues and you're not feeling better, you should get medical help. And then a heat rash is just red blisters that can appear on the skin from the heat, and you just want to kind of, try to keep the rash dry and clean, and maybe use like a powder to soothe the rash. So you can see that there's really a range of heat-related illnesses that are directly related from heat, but then there's also a group of pre-existing issues that can be exacerbated because of heat as well. So in terms of air pollution, in 2015, it was responsible for 6.4 million deaths worldwide. 2.8 million of those were from household. So things like, when we think about globally, people who have indoor, they cook indoor using wood fireplaces or other materials that are going to actually pollute the air and have a direct impact on people. And then ambient air pollution was responsible for 4.2 million deaths. And this is an underappreciated cause of non-communicable diseases, although I think people are getting more aware of the impact of air pollution on health. So this comes from here are the 5 major pollutants, which include ground level ozone, which is different from higher level ozone, which protects us from harmful effects of the sun. Ground level ozone is created. It's a combination of when heat mixes with pollutants in the air that come from combustion, car idling, industrialization, all of those things together, when they merge with in warmer weather, that becomes ground level ozone, which is dangerous for us. And then particulate pollution, which is also known as particulate matter, and this includes PM 2.5 and PM 10, and the 10 and the 2.5 refer to microns, so that's the size of the particulate matter. And then carbon monoxide is a pollutant, sulfur dioxide, and nitrogen dioxide. And so these are measured, and together the government, local cities and towns monitor the air quality, and they're looking at these 5 pollutants when they factor in the quality of the air. Air Now is a great site that you can go to. I have the website here. You can download an app. Now I get air quality on my phone. I'm not sure how accurate that is or what exactly it's measuring, but if you go to Air Now, you can type in your zip code, and it will give you information about air quality in real time. And there's also an app. I think you can get the information through email, but it has lots of good information, not only about what is the current air quality, but what you can do to lessen your risk when the air quality is not good. And so this is the air quality index. As I mentioned, it looks at that range of pollutants, and it comes up with a number basically from 0 to 500. And you can see 0 to 50 is good, 51 to 100 is moderate, 101 to 150 is unhealthy for certain groups, 151 to 200 is unhealthy, 301 to 500 is hazardous. So it's set up on this color-coded scale and allows you to know how you're going to be impacted. And then what's important for you to know is to think about if you're in a particular group that could be more at risk than people without pre-existing conditions like respiratory or cardiac conditions, for instance. This is just showing you kind of a comparison of the PM 2.5 and PM 10 in relation to things that we're more familiar with, like a human hair, which is pretty thin, or a piece of fine beach sand. And so the only way you can actually see PM 2.5 is through an electron microscope. And so, and you know, we see pollen with our eyes. You know, right now it's all over my car. It's probably over other people's as well. But that's important because these particles are so small that they're easily inhalable without any kind of, without our kind of mounting a protective mechanism like a cough or something like that. And so they get into the lungs and they cause inflammation. And that inflammation is what then kind of causes damage to the cells and the tissues within the lungs. And this, as I mentioned, so there's ozone and then there's the particulate matter. And the particulate matter, I should also say, is, you know, that's something that can be in your house. You know, ozone is more kind of an outside thing related to, as I mentioned, exhaust and gasoline and kind of like, as it says here, you know, volatile organic compounds and how they kind of interact with sunlight. Particulate matter you can have high levels of particulate matter in your home. And, you know, just recently, like this week, or maybe it was late last week, there were wildfires that was impacting our atmosphere, at least up in the Boston area. And, you know, people were talking again about how beautiful the sunset was because it was pink, but it was pink because of the level of particulate matter in the air. And so it's important to think about, it might be pretty, but it's not necessarily good for good air for us to be breathing. So how air pollution impacts health, it can actually have an impact, a negative impact on lung development. And this is something that's been demonstrated, at least in monkeys, and I think perhaps humans, in the California area from wildfire smoke. They actually looked at, there was a primate facility, and at the time of one of the big wildfires, many of the primates were pregnant, and they actually looked at the lung development of their babies, and it was definitely impacted by air pollution and particulate matter in particular. Increases in respiratory disease, asthma, people who have COPD, which is a chronic lung disease, will have worse impacts. Lung cancer, cardiovascular disease. So air pollution can contribute to stroke, MI, heart failure, which is ischemic heart disease, and likely neurodegenerative disorders in adults and neurodevelopmental disorders in children. So there's mounting evidence that air pollution is impacting people is leading to higher levels of Parkinson's disease and dementia. So then when we look at these two together, again, this is from the same study that was done out of the Mystic River Watershed Association and the Museum of Science. This is looking at the impact of air quality and heat together. And again, this is the same map that I showed you previously for tree cover and heat. And when you pair heat and air quality, you can see a very similar pattern in terms of Boston being kind of hit hardest. But there is an area up here around Woburn and Reading that has some deep purple as well, which is interesting because I actually grew up in Wilmington, and there were some environmental justice issues around Woburn in particular that had to do with leather factories and the tanning solutions, which contributed to higher rates of cancer. So that's interesting to see that there. A word about the vocabulary we use when we're talking about climate change in general, but mitigation refers to really reducing and stabilizing greenhouse gas levels in the atmosphere. Adaptation refers to our vulnerability and how we can positively, at least as positively as possible, adapt to the changes that we're seeing. And resilience is the ability of individuals and communities really to plan for, absorb, and recover from these adverse events that we see. And extreme heat is certainly one of those. And of course, there are health co-benefits if we eat a more plant-based diet, if we walk or ride our bikes instead of taking our cars. That's, helpful for the environment. So really, prevention is key in terms of heat and in terms of air pollution. We can't completely mitigate these things, I would say, but we can certainly take steps to kind of optimize our health in the face of extreme weather and air pollution. So some of this stuff we all know, you wear lightweight clothes, you stay indoors when it's the hottest, and that's a really critical one. That's important, especially for older adults. It's important for kids. It's important for people who engage in physical activity. You want to really time that appropriately. If you have air conditioning, that's great. If not, you want to think about where else you can go to stay cool during these episodes of extreme heat. And, when we talk about the impact of air pollution and heat, you certainly want to close your windows when it's appropriate, but it can be very dangerous, obviously, to close your windows during extreme heat because that's going to put you more at risk for a heat-related illness. And then cool showers are good as well. You want to stay hydrated. You want to eat light meals during the heat. You want to limit alcohol and sugary drinks, as we mentioned. You don't want to wait until you're thirsty. You want to drink on a regular basis. And of course, if you have a pre-existing cardiovascular problem, that's something you need to talk to your physician or your provider about. But particularly for older people, as we age, we lose our thirst, our sense of thirst. So it's really important not to wait till you're thirsty because that could be, it's too late because your body's already begun to compensate. And there's only so much from a physical standpoint your body can do. And one of the ways that it compensates for high heat is by vasodilating your blood vessels so that heat can be kind of like released through the skin. And so when you vasodilate your blood vessels, you actually need more volume because the tank becomes bigger in a way. So you need more volume to keep that tank full. So it's really important to stay hydrated. And then if you're on any medications, you really want to talk to your provider about any changes that should be made to your medication regimen. So for instance, if you're on a diuretic, which is a fluid pill, that could impact your level of hydration on a hot day, but at the same time, you don't want to stop that without talking to your provider and getting sound medical advice. Other medications that can impact from a physical standpoint your ability to kind of adapt to high heat days, some psychiatric medications, cardiac medications are two categories that can be impacted. So just know the signs and symptoms of heat-related illness. Get out of the sun. Try to avoid the sun on hot days and the heat. But definitely know what you need to do if you start to feel symptoms. The local news is very good about having extreme heat alerts. Look to your local community to see if there are cooling centers near you, and watch the weather forecast or listen to it or look at it on your phone. And remember to check on older neighbors who may be isolated because they're very at risk, as are your pets. You want to make sure to take care of them. These are, I mentioned that airnow.gov site, which is everything air quality. And these are some guides that they have available on there that show both ways to protect yourself, but also how you can decrease your ozone and particulate matter pollution, your individual contribution, which is kind of a good thing to look at. You know, one big thing that contributes to air pollution is car idling. So that would be an important thing not to do. If you have asthma, you know, you want to decrease your use of fire, for instance. But these are interesting. They're not, they're really made for the lay public, and they cover ozone, particulate matter, and guides for schools and school kids. So a few ways that are targeted to ozone would be if you're, you know, exercising outside on a hot day where the smog level is high, you want to maybe either delay your activity or decrease its intensity, take more breaks when you're outside, doing anything that, you know, activity related, move your activity inside where ozone levels are usually lower. And then with particulate matter, you want to, as I mentioned, reduce your use of fireplaces and wood stoves, candles, and smoke. And another thing you can do if you are someone who has existing respiratory or cardiovascular disease, is you can get a HEPA filter, which will clean the air on the inside of your house. And they're relatively inexpensive, but they're not cheap, but they're good for people who might have, for asthma in particular, during this time of the year. But again, particulate matter is not necessarily related to hot days. It can be, you know, any time of any season, particulate matter can be an issue because of things like wildfire smoke and other liquids and solid, very small substances that can get in the air. And certainly air pollution can happen in the winter, but we know that ozone is really that interaction between the heat and the sun and pollutants. And so these are some resources that I just, in addition to some of the resources I included earlier, these are some other ones that might be of interest to people related to heart disease, stroke, and outdoor air pollution, asthma and air pollution, and air quality index, which is a great informative document that talks about what is air quality, again, how can you measure it, and how it impacts individual health. So thank you. That's what I have. Patrice, do you want to?
Sure,
Yeah.
Suellen. Thank you. Suellen mentioned we have a manuscript that just came out in the Journal of the American Association of Nurse Practitioners, and it actually utilizes the heat-related illness screening tool that Suellen shared on the slides, and the different factors, environmental, socio-demographic, et cetera. And in that paper, we actually highlight a firefighter who is fighting a fire in extreme heat. He also has a history of asthma, and he actually was in a moderate to high risk of being impacted by heat-related illness and serious heat-related illness in the case study that we have in that paper. I also wanted to mention that the pediatric population in particular are at high risk. Prior to COVID, the MGH Institute of Health Professions, which resides in the Charlestown Navy Yard, was actually a respite center during the summer for students from the city of Boston who were taking sailing courses. And on days of exceedingly high heat, 95 degrees. And I remember one day in particular, plus 95 degrees, where instead of sailing, the students were brought to the third floor of the Institute, which was an air-conditioned building, for them to have activities rather than to be out on the harbor in the extreme heat and humidity. And the other area that really all of us have a responsibility for is assuring that children are protected from heat and humidity in the summer months. So because there's been so much of a focus on sunscreen and avoiding sunburns to hopefully avoid skin cancer, there's been a lot of progress made in pediatric offices with physicians, nurses, and nurse practitioners, but less so regarding health professionals being well aware to educate parents and children about avoiding heat and heat stress, particularly in the summer months. And it's really important that this be done because often children go to camps, which are primarily outside. Not only do they need sun protection, but they need protection from the dangerous dance partners of heat and humidity and poor air quality. And so I'll stop there and see if there are questions for Suellen or and for me.
Thank you so much. If you have any questions, feel free to enter them in the chat. We have a question regarding heat index. Are there any online resources where we can check the heat index in our city or town for the day?
Oftentimes what I've noticed is like the weather people will say that, or they'll, I'm not sure of an online real-time resource, but certainly if you know the temperature, well, I would say this, one rule of thumb is this: if it's a hot day and it's humid, and we typically know the relative humidity, you can know that your body is gonna react as if it's hotter than it actually is because of the combination. But that's not to discount dry heat as well. Because a hotter day that's dry is just as serious as.
And Suellen, I just added the National Weather Service
Okay.
conversions and calculations for heat index. And it has one column using dew point temperature and another using relative humidity, and it can calculate. I put it in the chat.
Thanks.
Mm-hmm.
Are there any cutoff points that we should be aware of where we should be more mindful in regard to, you mentioned, the temperature and humidity?
Are there any what points? I missed that.
Any range or a cutoff point where we should be more aware of, like if it reaches a certain temperature at a certain humidity, then we should really be more careful and seek shade and staying hydrated.
So what I would say is two things. One is that National Weather Service chart kind of points out where kind of the trajectory of caution to extreme danger, which I think is important. I also think to a certain extent it's individual based on, on you and what's going on. Like, so for instance, I have asthma, which is a newer diagnosis for me. And so I'm kind of careful not to, I wouldn't go out for a walk at 12 noon on a really hot, humid day, because that just wouldn't be wise. So I think it's thinking about, do you have any pre-existing illnesses? What is your lifestyle? And then, I think we call a heat wave over 90 degrees, right? But think that if it's a humid day, it could be in the 80s and it could still have a heat index that is above 90. So I think I don't think there's any one number to think about. It's more about to take all those factors into consideration.
Mm-hmm.
And that's what we tried to do with the screening tool. is
Mhm.
to kind of give a comprehensive look at what puts people at risk.
And as Suellen mentioned, that the National Weather Service heat index is really helpful. In particular, some parts of the country, for example, Arizona, they may have, for example, 90-degree heat, but the relative humidity is much lower. And it's not as dangerous as, for example, 90-degree heat in the Boston area in summer with a 70-degree relative humidity, or Florida for that example, for another example. So that National Weather Service heat index can be really helpful. I'll put that in the chat as well.
Thank you.
And also to think about, as I mentioned at the beginning, this extreme heat belt is really hitting the center of the country that has, even though Florida has, water and ocean, air, it's really the middle of the country that's going to see the most severe impacts.
Mhm.
Thank you. What can we do as health professionals to address extreme heat and air pollution with our patients?
I think we can, I'll start and I'll let Patrice chime in. I think one huge area is patient education. And again, I mentioned earlier from the article by Philip Landrigan, who's done a lot around air pollution, it's underappreciated cause of non-communicable diseases like stroke, heart attack, heart failure, respiratory disease, all those things, dementia, Parkinson's most likely. So I think educating people is really important. And again, I'll use myself as an example. It wasn't until I went to the allergist that I was really given any kind of education about like air quality strategies. That's something we as health professionals can definitely do. Talk about HEPA filters, talk about things in our own life that we can mitigate, that we can kind of control to help lessen the burden on us. And so I think health professionals have a huge role in educating each other and educating patients, and then certainly advocacy. So one of the things that we have partnered, we have like a very nascent relationship with Mothers Out Front, which is an organization that was started actually by someone who lives in Charlestown, but it's a national organization, and it's people who are advocating for clean air policy in their respective cities and regions. And so we have Mothers Out Front. We have 2 people coming in a few weeks to do a lunch and learn with us, and hopefully we're going to get some student engagement around some of the things that we can do. And the way they do this is very simple. You can write a letter. They give you kind of the template, but the woman who's coming to talk to us is a mother from East Boston. So they're hit by Logan Airport. They're hit by the Chelsea Creek, where all the big tankers come in with diesel fuel and all of that. And one of the things that I participated with them a couple months ago was around car idling. So now what's happening at airports, I'm sure everywhere, is you call your Uber or your Lyft, they're in the central parking, they're waiting for you, they're in their car, they're idling. And that contributes to the air pollution in addition to the planes and the diesel. And that's something that we as health providers can kind of look for ways to either partner with other people to advocate for policies that will impact air pollution, heat resilience plans. And those are just 2 things, but there are all kinds of climate impacts that I think health professionals, especially because we're trusted professionals, can make an impact.
Mm-hmm. I think the other area too is occupational heat stress. So, for example, agricultural workers are really heavily impacted by occupational heat stress. They often don't get enough access to heat breaks or enough access to water. And as a result of that, and they're sometimes disenfranchised workers. So as a result of that, they may get severely dehydrated and experience severe heat-related illnesses. And Dr. Gora Basu, who's at Cambridge Health Alliance, and Suellen knows him well because she's in the Harvard Medical School Cambridge Health Alliance Climate Health Organizing Fellowship. He actually has seen a patient who's 25 years old experience such severe dehydration that his kidneys shut down and he's now awaiting a renal transplant. So disenfranchised workers exposed to high heat and humidity are another very worrisome population. And in the United States, we have OSHA, the Occupational Safety and Health Administration, that protects a lot of workers. So, for example, construction workers in general may have a foreperson or a head of the construction project that is must stay apprised of the heat and humidity conditions and assure worker safety, but other populations of workers do not have that safeguard. So there's a lot to think about as health professionals, but also the lay public, all of you in the listening audience, thinking about protecting patients and your own families.
Thank you. Where can one go to learn more about advocacy groups that are happening in our communities, if in case we wanted to participate in, like, take action in some way?
I mean, I guess one place you could go to would be your local town government. That would be, I mean, I know, for instance, the town I live in has an environmental sustainability committee. There are ways, so that would be one avenue. I mean, I think another avenue might be like just kind of looking on the internet and putting in a search around climate advocacy. A lot comes up. Those are two things I think I would suggest, because I think there's a lot of work going on without, I think there's a lot of pockets of really good work happening, that, you know, I guess another thing you could do is just like talk to the people you know and get a sense if they are involved in anything.
Mm-hmm. And the city of Boston has Climate Ready Boston. I just put the link in the chat as well. So Mayor Wu has a climate expert. Reverend Mariama White Hammond is who previously worked at, I think, the Bar Foundation or the Boston Foundation. And also Governor Healy just appointed somebody who's a climate expert as well. But if you're living in the city of Boston, or even if you don't live in the city, the resources that they have for Boston on boston.gov are helpful, and they may help you link with those in the area where you live.
Thank you. Suellen, you had mentioned HEPA filters a couple of times. In general, do all air purifiers have HEPA filters?
I think, but I mean, I'm not an expert on this, but I did buy one myself. I think when you Google, like, well, if you go onto Amazon or someplace like that, or it will give you the specifications, but you really want one with a HEPA filter because they actually can filter out, you know, small particles. So I would suggest that's the kind you would want.
Thank you. And I wanted to personally thank you both. It's been a wonderful collaboration putting on these monthly talks. Given that we're going to take a break for the summer, is there any way for folks to keep up to date on, you know, all the great work that you're doing in the meantime? Any online resources?
We have a website, which Patrice just put in the chat. It's semi up to date, let's put it that way. But you can also find our contact information on the website, and people can feel free to reach out to either one of us if they have questions or comments, or we're there to kind of help people, I think, if there's a need for that.
I'll also put in the chat the MGH's Center for the Environment and Health, which is a really good source of information as well.
And the one other thing, as Patrice is doing that, is on both of those websites, both the MGH, who we collaborate with, and ours, we have monthly webinars. Now, I can't remember our summer schedule, but the schedule for those are on there, and also past recordings of the monthly webinars are on there. And so these are, we call them grand rounds, but we've had a great range of excellent speakers that I think, while it's pretty much geared for health professionals, it's very relevant. I think most of the webinars have been very relevant for just individuals in general.
Thank you. And I just realized, I'm sorry, Patrice has shared many great resources. I don't believe it's available to everyone in the chat. So why don't I spend a minute or two to share them all with everyone else in the chat. In the meantime, do you have any final thoughts you'd like to share with the audience?
I guess just thank you for your interest, and the more we can kind of spread awareness, it's a step in the right direction. There's still a whole lot more to do, but I think that, we just appreciate your willingness to come and listen.
Thank you, and apologies, I didn't realize I was just posting to hosts and panelists. Thank you, Amy, for making those resources available to all.
Thank you. There's just a few more. If everyone wants to hang in for another minute or two, I can gladly share all those wonderful resources. And as I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. I have a few more, and I think should be good to go. Patrice, do you mind sharing that IHP one?
Sure. Let's see, here it is. Oops. I'm just copying it right now.
Actually, your last one has it, so I think I'm good.
Okay, I just
right.
pasted it again too.
All right, well, everyone, thank you so much. As we had mentioned, we're taking a break this summer, so stay tuned, and we hope to see you all in the fall. Have a good day.
Great,
Thank
you.
you.